Hello, beautiful health hackers. Welcome, welcome, welcome. My name is Dr. Niti, and in this video, I'm going to talk about one of my most favorite vitamins, a supplement of all time, vitamin D. Vitamin D normally synthesized from our skin by the sun. However, most of the time at this day and age, we don't get to wear, short sleeves, short, get outside with no sunblock, right? Either the weather too cool around here where I live in Monterey, and or also we are mostly sedentary, so we mostly indoor more than outdoor. And the understanding in the medical community about vitamin D is also lacking behind. There's a lot more research study nowadays, but it used to be vitamin D was like totally a very limited knowledge that we have. When I was in fellowship in GI nutrition, nobody taught me anything about vitamin D, seriously. And then in 2010, vitamin D made the big page in New York Times, the newspaper, that the scientific page. So all right, let's start with, so we don't get mostly naturally, so we have to get it from extra supplement, because also vitamin D is lacking in the food. There's limited amount of vitamin D in egg yolk, shiitake mushrooms, so some mushroom have that, and there's not a lot of those things that we're going to eat enough to get. And another thing is that there's two forms of vitamin D, vitamin D2 and vitamin D3, they're commonly known. In the milk, there's vitamin D2, which is not very well absorbed, and it's only 100 international unit in the 8 ounces. You're not going to drink enough milk to get that. And especially a lot of us probably have issue with milk anyway. And then there's also the old belief that the dosage of vitamin D, the RDA, recommended dietary allowance, was listed as 2000 IU a day for adult. That's it. And that is not enough. I have treated a lot of children that's smaller than adult, and yeah, those doses, if they deficient, which almost everyone are, it's pretty much inadequate. Year after year, you check the level, it stay below 20 usually. And that's make you more prone to many diseases. They're well researched these days with the effect of vitamin D preventing diseases, including infection when the COVID was ravaging over the past 2-3 years. So we got a lot of research that address that. And so the dose is one thing. And then to understand that vitamin D is a fat-soluble vitamin. So the idea is that you do not have to take them every day. If you really want to get to the maintenance dose, you can take them every other day, like Monday, Wednesday, Friday. So if you forget, you can also take a double dose the next day. And the main side effect is mostly nausea, vomiting, and it's reversible. If you take mega dose, according to the study back in the 50 to 60, people get infused in the hospital 150 to 600,000 units. That's too much, okay? However, the 2,000 is not enough for adult. That's what I experience when I do blood tests in a bunch of my patients over the past more than 7 years, almost a decade. And that's, I know the level, and my level took 3 years to come up. And especially if the person have a lot of body fat, that's gonna take more of the vitamin D out of their blood into the fat or adipose tissue. So the blood level gonna be even lower, and it take longer to come up. That's my experience. Firsthand, real life with the blood drawn follow-up every 6 months in my patients population. And then what does vitamin do for you? After all this, why are we taking it? First of all, for women, it helps with metabolism and weight, and it affects your hormone in a big way. It's a precursor, just like cholesterol is precursor of the sex hormone. Vitamin D is a part of your sex hormone family. So it's very important that you keep that in a good level. okay? And it reduces, studies show, abdominal fat. So it makes your metabolism better, reduce your abdominal fat, help you lose weight, help you maintain healthy weight better. But it affects from head to toes, over 2,000 good genes it turn on. So you want your good genes turned on, right? So definitely take vitamin D, please. And affect your bone, as you probably know, it affects calcium, phosphorus, calcium metabolism. And that's why also, and it affects your gut as well. And the brain and the gut are connected. So it affects your mood, right? And your energy level. Also prevent some of the diseases like cancer, heart disease, diabetes, and infection. And in the cancer category, colorectal, ovarian, prostate. And because of these hormonal effect, and breast cancer as well, because of the hormonal effect. So definitely make sure that your vitamin D level get checked and that it's in good range. And by the way, another culprit of the what is normal is that the range in the adult is 30 to 100. Look how wide that is. Because when they're sampling the population, since it's estimated that 50 to 70% of Americans are vitamin D deficient, so the sampling population, the abnormal ones come into the norm, since they are the majority of the population that have low level. So now the norm is skewed because a lot of people are not normal. So keep that in mind, that level below 30, definitely not normal, but you may want to keep your level optimally above 50, maybe closer to 70, 80 range, because that's the range that it showed in one of the research during COVID, that 75 or above, that's the level to prevent ICU admission. So the good level for me is 70 to 80. And then the toxicity, the problem, beyond that is another thing that people concern is because it's fat soluble. So it tend to be going into your adipose tissue and it can store in your body that can cause long-term effect. You'll be extra careful if you have kidney problem. But in general, it's a very safe vitamin. And so, and at the least you can check your level every 6 months to keep it in good range. And I've never seen any toxicity in my career. And but if you do have kidney problem, just be extra careful. However, most everyone's low, I can predict. So take your vitamin D, check your level, and you will see the benefit. With all these, diabetes and obesity increasing, we Americans definitely need vitamin D supplement. And check with your doctor. However, keep in mind that a lot of time these vitamin D knowledge is a little bit lacking behind. So love to you all. Thank you for your attention. I appreciate your time. Can't wait to see you in the next video. Check out www.drniti.com and download the free Gem Veggies. So getting holistic health habits, get up and running with the awesome program, having an awesome life in no time. Bye for now. Love to you all.